I'm Dr. Nasir. I'm a plastic surgeon at the Hospital University Kebangsaan Malaysia in Kuala Lumpur, Malaysia. I graduated from the University of Melbourne in 1988, and later on I furthered my studies and got my fellowship of the Royal College of Surgeons of the Edinburgh in 1993, followed by the Masters of Surgery at the University Kebangsaan Malaysia in 1995. And later on, when where I decided to pursue my further skills and studies in plastic surgery, I went to the University of Texas in Galveston, and also to the University of Tokyo in Japan. I actually do the whole range of plastic surgery, but of course, my favorite sort of surgeries, if you like to know, is actually the short scar facelift, and also the breast reduction, where we use the vertical scar, which is the minimal scar breast lift. But of course, I do not actually restrict myself to only those surgery actually. I think it's easy to say that all surgeons are good and they have to be good, okay? But what makes them great is the ability to listen to the patients well, take care of the patients well, honestly taking care of them, okay? Take care of them not only in terms of doing the surgery and aftercare, but I think whenever there's complication occur, they must be able to tackle also the complications and make sure that the patients become all right at the end, and they can consistently produce good, or should I say excellent result every time, okay? And the complication rate is almost zero. I think that's a great surgeon. Of course, sometimes maybe it's difficult to achieve this, but the only way that a surgeon can become great is by him or her doing and performing many surgeries over many years. Okay, so I think it's very important that you must, of course, have some background information that that particular surgeon is good and he can deliver good result consistently, and then you yourself might actually develop a rapport or relationship with that surgeon, so that the surgeon can give the best to you. Okay. So overall, I think you must review result that the particular surgeon has produced. Okay, that's the only way is by maybe reviewing his photographs that he have before and after, and then more importantly, actually talk to the other patients who have undergone surgery with him or her. Firstly, they must be aware that they must be clear of what they want. Okay, for example, they want their breast to be augmented. Okay. So they must be clear that what type of size they want, how big it is, okay? What sort of long-term things that you look for, okay? And then you must know that whether you have any other associated problems, maybe that you need to be sorted out together with that, like lifting of the breast, because of course each individual breasts are different, okay? So you must be clear about what you have and what you want, okay? And then number two, I think very importantly that you must have both the physical ability, that means you must be healthy enough to undergo the surgery, and also you must be mentally prepared to undergo those surgeries, especially those who are looking for lengthy, multiple procedures. Yeah, and it's also important that they actually convey what is the outcome they expect from the surgery to the surgeon. I think that's very important, because the surgeon can only predict what actually the patient wants with the information that you give. In summary, I think it's easier if you're not sure whether the medication that you're taking are going to cause problems, to actually contact the surgeon who's going to perform the surgery, so that he can go through the list and advise you accordingly. You can continue taking multivitamins, which is, I think, quite good for your recovery, but try to avoid medication that might cause problem, especially bleeding after surgery. I, of course, recommend highly my patients to wear pressure garments or some form of supportive garments especially those who had just undergone breast surgery, such as breast augmentation or breast reduction or breast lift. The aim is actually to give comfort to the patient, of course, number one. Number two, for those who have implants, to make sure that the implant doesn't move, and which later on will cause asymmetry of the breast. And also to allow patient to be a bit more mobile without causing pain to the area of surgery. Okay. And then, of course, those who have just had tummy tuck or liposuction, they must, to me, wear some form of pressure garment for about 4 to 6 weeks. The aim is actually, apart from the support, is actually to mold back the contour of the tummy or the thigh or the arms to get an even contour. And also to minimize swelling, and at the same time that would also minimize pain. Seeing the happy face of my patients after I have sort of transformed them to whatever they desire, I think that's the most satisfying feeling. And the other thing is about my plastic surgery is it's where science and art merge. I can use scientific knowledge and apply it on the patients and use my artistic ability to transform them. Okay, so it's not only science that is working, it's your ability to have an abstract thinking and trying to go into the mind of the patients to really get to know, to understand what actually they desire or they want to their body, right? Whatever face they want, the nose or the breast or the tummy. So I think that gives me a lot of satisfaction. Okay, what makes a woman gorgeous? I think it's a combination of physical beauty and the character beauty. So meaning that you have to be both good externally and internally for you to look gorgeous, and people will say that you are actually gorgeous. I would like to really recommend all of you who are pursuing to have cosmetic surgery done to actually do come to Malaysia. And of course, we have the high standard of care here, as good as any other developed nations. We use the latest technology, the latest surgical techniques, and we have one of the best hospitals in the world. And we have enough manpower to take care of you. And of course, Malaysia is a beautiful country. We have all sort of cultures, all sort of food for you to enjoy, and you won't feel like you're wasting your time when you're in Malaysia. So you can have surgery done, you will look beautiful after that. At the same time, you will enjoy your stay so much that you will love to come back here. Maybe not for plastic surgery, for other things. So do consider, please come to Malaysia for plastic surgery.